Here's a USMLE-style question about the progression of disease following CNS invasion by rabies. Question: a 30-year-old man presents to the emergency department with confusion, agitation, and hydrophobia. He reports being bitten by a stray dog 6 weeks ago while traveling abroad. He did not receive post-exposure rabies prophylaxis. On examination, he is febrile, and his neurologic exam shows hyperreflexia, muscle spasms, and autonomic instability, including tachycardia and profuse sweating. Over the past few days, he has developed increasing difficulty swallowing, muscle weakness, and paralysis of the lower extremities. Which of the following is the most likely progression of disease in this patient after the rabies virus has invaded the CNS? A. Virus replicates predominantly in the cerebral cortex, leading to seizures and loss of consciousness. B. Viral replication in the spinal cord leads to progressive paralysis, especially of the respiratory muscles. C. The virus spreads through the cerebrospinal fluid, causing meningitis and encephalitis. D. Viral spread through the bloodstream leads to diffuse encephalopathy and multi-organ failure. E. The virus targets the brainstem, leading to vomiting, severe headache, and increased intracranial pressure. Answer B. Viral replication in the spinal cord leads to progressive paralysis, especially of the respiratory muscles. Explanation: after the rabies virus enters the central nervous system, CNS, through retrograde axonal transport along peripheral nerves, it primarily affects the brainstem, spinal cord, and motor neurons. The virus replicates in the spinal cord, causing progressive neurologic symptoms such as muscle weakness, paralysis, and autonomic dysfunction. As the disease progresses, paralysis often becomes more severe, particularly involving the respiratory muscles, which can lead to respiratory failure and death if not treated. A. Virus replicates predominantly in the cerebral cortex, leading to seizures and loss of consciousness. The virus does not primarily affect the cerebral cortex. It tends to target the brainstem and spinal cord, leading to autonomic dysfunction, hydrophobia, and paralysis. C. The virus spreads through the cerebrospinal fluid, causing meningitis and encephalitis. Rabies typically does not cause meningitis. Instead, it causes encephalitis in the brainstem and spinal cord, leading to characteristic symptoms such as agitation, hydrophobia, and progressive paralysis. D. Viral spread through the bloodstream leads to diffuse encephalopathy and multi-organ failure. Rabies does not spread via the bloodstream to cause multi-organ failure. It primarily spreads through the nervous system. E. The virus targets the brainstem, leading to vomiting, severe headache, and increased intracranial pressure. Although the virus affects the brainstem, the symptoms are more focused on autonomic dysfunction, hydrophobia, and progressive paralysis, rather than vomiting and increased intracranial pressure. The progression of rabies following CNS invasion involves paralysis, particularly of respiratory muscles, which is often the cause of death in rabies-infected individuals.